At the height of the initial coronavirus outbreak, we became familiar with the term flattening the curve. With Northeast Florida at the epicenter of the current surge, people wonder, when will we see a flattening of the curve this go round? Well, if you look at this map from Mayo Clinic, you see that Jacksonville and the surrounding counties are highlighted in a color much darker than others. It's because of the staggering number of cases here. Again, when will we flatten the curve? Predictions from Mayo researchers indicate no time soon. Look at the numbers in cases. They're expected to double over the next 2 weeks. Joining me on the morning show, Infectious Disease Specialist Dr. Reza. Good morning.
Good morning, Bruce. Thank you for having me.
Forget flatten the curve. The numbers go straight up. And now we learned this morning that this Delta variant spreads like chickenpox. So if we think things are bad now, forget about it. It's going to get much worse.
That's what it looks like. If you, just for comparison, if you look at the last time we hit a peak back in January across our country and in Duval, the rate of transmission was about 116 per 100,000 citizens. And now we're looking double that already. We're about 200 plus per the Mayo Clinic predictions. And that's going up further. So that's where we are. We're already double what we were at our peak in January.
Hospitals are filling quickly. What does this community need to do right now to stop the spread? So
right now, it's just so important to put a well-fitted mask on, even if you're vaccinated, because we see how infectious this Delta variant is. I urge everyone to get vaccinated, of course, but those vaccines will not provide the protection we need today. If you're getting Pfizer or Moderna, you're looking at 5 to 6 weeks out after that initial shot to get the protection. But you want to wear that mask, a well-fitted mask over your nose and mouth that will provide that layer of protection against this more contagious variant, as well as avoiding large indoor gatherings. This is how this virus transmits. Something that's infectious as chickenpox, it will spread pretty rapidly in indoor closed areas with multiple people around you.
And when you look at the fact that hospital beds and beds in the ICU are at a premium, this could have a devastating impact not just on COVID patients who need help, but people in life and death situations, someone who suffers a heart attack or a stroke.
Yeah, Bruce, we've been talking about this now for several weeks. What this does to our healthcare system is it overstrains our healthcare system. So when we're over-inundated with so many patients coming in with COVID-19 infections, our staff is to the brink, our capacity is to the brink in our hospitals, and we can't afford to do that. So we're already there to an extent. So we need help from the community to do what we need to do to put this fire out.
And you've got members of the hospital staff who are getting sick. And then there's the mental stress.
There is, Bruce. We've been dealing with this now for a year and a half. I work in the hospital setting as well. And I see the fact that we're having to do this all over again, right? So every time we go see patients with COVID, we see how transmissible this Delta variant is. And we put ourselves at risk and our families. I have 3 young kids that cannot get vaccinated. So I put my whole family at risk every time we go see this patient. So it's scary at the end of the day, being a frontline worker and having to do this. And we don't have to be here. That's the thing.
That said, does it frustrate you that this was all preventable, that we did not have to be here?
It does. It does. And if you talk to any clinician across the board in the front line, we don't have to be here. If you look at counties and states that have high rates of vaccination, 75% higher, their rates of new diagnosis of this infection is markedly lower. The hospitalization is markedly lower. So it is. But at this point, we can still do something. That forecast doesn't have to be our fate, is what I'm saying. Wear that mask, avoid large indoor crowds, wash your hands, and get vaccinated, please.
The virus has control of us right now, but we can take control of things we can control by wearing a mask. Dr. Reza, thank you for your time.
Sure.
Melanie.
Thank you.